Hello, this is Angelia, and you are listening to or watching the podcast Why You Do What You Do, the podcast that talks about human development and psychology to help you figure out maybe a little bit more about why you do what you do. And last time we were talking about, we were into child development. We were talking about outside environmental hazards that can affect your child. These can be chemicals, radiations, extreme heat and humidity, and other hazards that are in our environment. So, if you find out you're pregnant, you need to stop doing these things. Radiation especially can cause genetic mutations, So that's definitely something that you don't want to be around if you're pregnant. And if you're working in a hospital, sometimes they have the little aprons, for you. Or you can ask to be transferred, somewhere else. But, protect that baby because they'll thank you for that later on in life. Environmental influences, paternal factors. Now, a lot of people think about the mother, what the mother is doing as affecting the child only. But the father also plays a part in creating this child. So what the father's doing also plays a part in how this child is formed and develops. So like the father too can transmit environmentally caused defects. So if dad's working around toxic bad stuff, that also is going to affect the child. A man's exposure to marijuana or tobacco smoke lead large amounts of large amounts of alcohol or radiation, DES, or certain pesticides may result in abnormal sperm. And I knew a guy whose kids could not grow hair. Their hair was so thin, and it never got longer than this. And now he was exposed to a lot of chemicals, and, he might have taken a lot of pain medication for some pain that he had, and I don't know for sure that this is what affected his children, but I have a feeling maybe so. Men who smoke are increased risk of impotence and of transmitting genetic abnormalities. So, smoking's not great for anybody. But if you're trying to have a baby, it's definitely not great for your child. I personally think everybody should quit smoking, but, there are people who are just not on board with that. Pregnant woman's exposure to the father's secondhand smoke has been linked with low birth weight and cancer in childhood and adulthood later in life. So, just do the right thing for your kid. Do the right thing for your babies, Stop. All right. Monitoring prenatal development. Not long ago, almost the only decision parents had to make about their babies before birth was the decision to conceive. Most of what happened in the intervening months was beyond their control. And now we have, of course, prenatal development, and this, your obstetrician, your pediatrician, and they're going to keep track of the baby and how big the baby is, how much the baby weighs, is the baby developing normally, ultrasound and amniocentesis. Now, of course, most of us who have had children have had the ultrasound. First, get your little picture of your baby, and it's the sound waves, in your early prenatal care, it follows the fetus's development. It's a diagnostic tool that presents an immediate image of the fetus in the womb so that you get to see your baby, before it's even born. Now, amniocentesis is a little more invasive, and it can be dangerous. So they are more reluctant to do that. Only when they have to do that will they do that. And other methods, embryoscopy, insertion of a tiny viewing scope into a pregnant woman's abdomen can provide a clear look at embryos as young as 6 weeks. And again, it's for early diagnosis and treatment of some abnormalities, like they found babies that have heart problems. They've gone in and done open heart surgery on a baby in the womb. I mean, that's amazing. Can you imagine, our parents and grandparents, when they were having kids, thinking that that was something that, would be something that people could do someday. That's crazy. Pre-implantation genetic diagnosis can identify some genetic defects in the embryos of 4 to 8 cells, which were conceived by in vitro fertilization and have not yet been implanted into the mother's uterus. And that's, like I said, nature will usually spontaneously abort a fetus that cannot survive. And in these cases, if they're manually implanting, this is a good way to know if that's going to be the case or not, so not to put that mother through that, to give her an embryo that is not going to be able to survive. She's under enough stress trying to have a child now. So prenatal care, this is where you go to your obstetrician and to get yourself looked at and taken care of. They're going to weigh you, take your blood work, all that fun stuff. Let's see, the proportion of U.S. mothers with late or no prenatal care, according to race and ethnicity. Late prenatal care begins in the last 3 months of pregnancy. And again, the percentage of live births involving late or no prenatal care. Our highest number is American Indian or Alaskan Native with 8.6. Now, this is because they are in isolated communities on reservations or villages. And usually they have their older women, wise women, who take care of this, So they don't really seek a lot of care outside of their own space. So, knowing that, that's a little bit misleading. But yes, they are isolated and they have less access to mainstream prenatal care. The next one would be Mexican Americans, 6.9%. And this is because, again, they might have people, grandmothers, mothers, aunts who, will talk them through this thing. They don't, have that as much where they come from now. It's become more nowadays, but, it's still not up to par. African Americans, 6.7%. And again, they are in usually areas where the care is substandard. And so they might not be really happy with the way they're treated sometimes. I know because I used to go to some clinics because I'm a Medicaid patient, and you don't get the best care there. I'm just afraid to say that, but it's true. Central and South American, 5.4%. Puerto Rican, 4.5%. Hawaiian or part Hawaiian, 4.2%. Anglo-American, white folks, 3.3%. Filipino-American, 3%. Chinese-American, 2.2%. Japanese, 1.8%. And Cuban-Americans, 1.4%. So they're actually pretty good about getting taken care of. And then across the board, 3.9% don't get prenatal care. And, that's a pretty small number, so we might not think that's something to worry about. But when you know that proper prenatal care can help you have a healthier child, and can help you be healthier, because there are things like preeclampsia and things like that you might not realize are happening to you while you're pregnant, So good prenatal care can give every child the best possible chance for entering the world in good condition to meet the challenges of life outside the womb. Challenges we discuss later on. So, take care of yourself while you're pregnant and take care of your babies. The experiences of the first 3 years of life are almost entirely lost to us. And when we attempt to enter into a small child's world, we come as foreigners who have forgotten the landscape and no longer speak the native tongue. And that's a quote by Selma Freilberg from the Magic Years in 1959. And that's true. We are just amazed that they're so amazed because everything is new and everything's exciting, everything's a curiosity, something to figure out, and it's like, and I think it's fun to hang out with little folks because I like to watch the way the brain works, the way the wheels turn and how they learn stuff. And they look at you like, did you see that? you know, and you're like, oh my gosh, you did it, that's great, and their face lights up, and just, you know, it's just amazing to me. The birth of Elvis Presley. Elvis Presley was born in a 30 by 15 foot cottage in East Tupelo, Mississippi. Today, the modest birthplace of the now legendary king of rock music is painted sparkling white. The walls are papered with primroses, and dainty curtains hang at the windows, among the many homey touches added for the benefit of tourists. But like many of the popular myths about Elvis's early life, this cute little dollhouse bears only slight resemblance to the realities: a bare board shack with no door, plumbing, or electricity, set in a dirt-poor hamlet that wasn't much more than a wide spot in the road. During the Great Depression, Elvis's near-illiterate father, Vernon Presley, sometimes did odd jobs for a farmer named Orville Bean, who owned much of the town. Elvis's mother, Gladys, was vivacious and high-spirited, as talkative as Vernon was taciturn. She, like Vernon, came from a family of sharecroppers and migrant workers. She had moved to East Tupelo to be close to the garment factory where she worked. Gladys first noticed handsome Vernon on the street, and then, soon after, met him in church. They eloped on June 17, 1933. Vernon was 17 and Gladys 21. They borrowed the $3 for the license. Elvis's daddy was younger than Elvis's mama. And actually, he's a distant cousin of mine. So, it's interesting that we're going to read about him in a little bit. At first, the young couple lived with friends and family when Gladys became pregnant. Vernon borrowed $180 from his employer, Bean, to buy lumber and nails, and with the help of his father and older brother, built a 2-room cabin next to his parents' house on Old Saltillo Road. Bean, who owned the land, was to hold the title to the house until the loan was paid off. Vernon and Gladys moved into the new home in December 1934, about a month before she gave birth. Her pregnancy was a difficult one. Her legs swelled, and she finally quit her job at the garment factory, where she had to stand on her feet all day pushing a heavy steam iron. When Vernon got up for work in the wee hours of January 8th, a bitterly cold morning, Gladys was hemorrhaging. The midwife told Vernon to get the doctor, Will Hunt. His $15 fee was paid by welfare. At about 4 o'clock in the morning, Dr. Hunt delivered a stillborn baby. The boy was Jesse Guerin. The second twin, Elvis Aaron, was born about 35 minutes later. Gladys, extremely weak and losing blood, was taken to the hospital charity ward with baby Elvis. They stayed there for more than 3 weeks. Baby Jesse remained an important part of the family's life. Gladys frequently talked to Elvis about his brother. When one twin died, the one that lived gained the strength of both, she would say. Elvis took his mother's words to heart. Throughout his life, his twins' imagined voice and presence were constantly with him. As for Elvis's birthplace, he lived there only until the age of 3. Vernon, who sold a pig to Bean for $4, was accused of altering the check to $40. He was sent to prison, and when the payment on the house loan came due, Bean evicted Gladys and her son, who had to move in with family members. In later years, Elvis would drive back to East Tupelo, now Tupelo's suburban Presley Heights. He would sit in his car in the dark, looking at the cottage on what is now called Elvis Presley Drive, and thinking about the course his life had taken. So, this shows you that no matter the situation you're born into, you can overcome that. You can rise above that, and you can do what you want to do in life. But you have to be willing to do that. You have to decide you're not a victim of circumstance. And that's a problem with a lot of people. What if Elvis had just stayed depressed, say, oh, I'm just a little nobody from nowhere, and, I'm just going to get a job here at this factory, or, be a sharecropper or whatever, that would have changed the whole scope of music as we know it today. So, the birth process. Parturition, the process of uterine, cervical, and other changes that brings on labor, typically begins about 2 weeks before delivery, when the balance between progesterone and estrogen shifts. And women, we kind of know what the baby drops, we're starting to feel like things down there are a little bit looser than they used to be. We start to feel that coming on. Stages of childbirth. Vaginal childbirth or labor takes place in 4 overlapping stages. The first stage, the longest, typically lasts 12 hours or more for a woman having her first child. In later births, the first stage tends to be shorter. During this stage, regular and increasingly frequent uterine contractions cause the cervix to dilate or widen. The second stage typically lasts about 1.5 hours or less. It begins when the baby's head begins to move through the cervix into the vaginal canal. People say he's crowning or whatever. And it ends when the baby emerges completely from the mother's body. If the stage lasts longer than 2 hours, signaling the baby needs more help, a doctor may grasp the baby's head with forceps, or more often use vacuum extraction with a suction cup to pull it out of the mother's body. And now I had a doctor that reached in and pulled out. My mother, they had forceps, back in the day. My brother had marks on his head from those. So, I was induced every time. I never would have ever went into labor. I have a funny pelvis. I have both my grandmother's pelvis. It's wide at the top and really narrow at the bottom. So, I would have probably never naturally been able to have a child. I probably would have died if we were, pre-inducing years, or they would have done C-section. So, electronic fetal monitoring was used in 84% of the live births in the United States to track the fetus's heartbeat during labor and delivery. And of course, they do that now. I think a gnat just buzzed my nose. Hopefully, it didn't go in there. And that's, to keep track of the heartbeat. And, they also have the little monitor where they have the, little zigzaggy thing on it, and you can take that home, and, it's just another special thing. Settings, attendants, and methods of delivery. Settings and attendants for childbirth tend to reflect the overall cultural system. Now, you might want to do it in the hospital. You might want to have them at home. You might want to have them in the pool, like some of these people, that have the water births. You might want everyone to be there. You might want no one to be there. And you might want to have a natural delivery. You might have to have a C-section. You might have to have an induced labor. We don't know. It just comes. Vaginal versus cesarean. Cesarean delivery is a surgical procedure to remove the baby from the uterus by cutting through the abdomen. And it's supposedly named after Caesar. That's supposedly how he was born. Now, I probably should have had one with my first child, because when the head of obstetrics came in, because the younger doctor, excuse me, who was there, couldn't get me to, dilate or anything. He said, we're going to induce you. And they came back, and he said, the baby's head, he said, we probably really should have done a cesarean section. He said, because it's so tight, the pelvic bones, we're having a problem getting him out. And like I said, they got me, they had me up, sitting up, pushing hard as I could. And I was just wore out. I was in shock, and I was shaking. And they did a episiotomy. I was cut several different ways to get this baby out of me, but he got out. But the doctor, the head of obstetrics, as he came past, said, yeah, he should have been watching you closer, and you probably should have had a cesarean. So, stuff happens. Natural childbirth, a method of childbirth that seeks to prevent pain by eliminating the mother's fear through education about the physiology of reproduction and training in breathing and relaxation during delivery. And of course, I had studied the breathing techniques and everything like that. Oh my gosh, so itchy. But when you're in the middle of that, trust me, it does hurt. It does hurt. And breathing might go out the window, especially, poor husbands, if they're in the father's in the room with you. My goodness. Oh, I'm so itchy. You're liable to just yank him and say, you did this to me, because I did that to my husband, so. Prepared childbirth, method of childbirth that uses instruction, breathing exercises, and social support to induce controlled physical responses to uterine contractions and reduce fear and pain. Because, like I said, you're going to be in pain. That's just the fact of life. So, the newborn baby. The first 4 weeks of life is the neonatal period and the time of transition from the uterus, where a fetus is supported entirely by the mother, to an independent existence. Because they were in the womb, they were getting fed through you, and now they're out. And they have to be in the world, and, it's kind of a scary new adjustment to them, Size and appearance. The average newborn or neonate in the United States is about 20 inches long and weighs about 7.5 pounds. So, like I said, mine were bigger, but some people's, I feel sorry for some of these people. I heard about a woman having a 15-pound baby, and I'm like, dear gosh. Yeesh. Anoxia, lack of oxygen, which may cause brain damage. Now, this can happen. That's one of the reasons they want to get my baby out as fast as they could. Because the baby can suffer lack of oxygen, especially if their cord is tangled, or if they've been in the canal longer than 2 hours, birth canal longer than 2 hours. This can happen. Meconium, fetal waste matter, excreted during the first few days after birth. Now, my sons were all overdue because doctors wanted to wait and make sure that they couldn't be born regularly. And my middle son passed meconium in the womb. So when they broke my water, they found out that had happened. And he had a rash all over his face, yellow red rash, looked like a little lobster, poor little guy. So that can happen if the baby's under stress, and he was a big baby to begin with. They shouldn't have let him go that long, in my opinion. I'm sure the doctor's not listening to me now, but they shouldn't have. And the baby can pass meconium in the womb. And that can cause lung problems and other things, because, they're breathing that fluid in. Neonatal jaundice, condition in many newborn babies caused by immaturity of liver and evidenced by yellowish appearance, can cause brain damage if not treated promptly. And I had a friend who had a baby that had jaundice, and they had him in the little incubator with the light and everything. And my youngest developed jaundice when he started eating food. And they said that's not uncommon, keep him in the light, and so... if you notice your baby having any yellowing to the skin or the eyes, you need to get that taken care of. You need to get that child seen as soon as possible. State of arousal, an infant's physiological and behavioral status at a given moment in the periodic daily cycle of wakefulness, sleep, and activity. So that's going to vary. Babies have an internal clock which regulates their daily cycles of eating, sleeping, and elimination, and perhaps even their moods. These periodic cycles of wakefulness, sleep, and activity, which govern an infant's state of arousal or degree of alertness, seem to be inborn and highly individual. So highly individual, all babies are different. So, you might have a baby that wakes up at 3 in the morning, wants to be fed every night until they're older. You might have a baby that goes to the bathroom every day at 2 o'clock. It's individual, so you can't compare and say, well, this one did this one should do this. No, they're all different. Survival and health. Although the great majority of births result in normal, healthy babies, Some do not. How can we tell whether a newborn is at risk? What complications of birth can cause damage? How many babies die during infancy? And why? What can be done to prevent debilitating childhood disease? How can we ensure that babies will live, grow, and develop as they should? The number one answer to that would be taking them to the pediatrician. There are people who, for supposed religious reasons or what, don't do that, and they're putting their children at risk. And unfortunately, they're willing to take those risks for their belief system. But I believe that, in and of itself, tells me you don't really love that child. Whatever. Medical and behavioral assessment. The first few minutes, days, and weeks after birth are crucial for development. It is important to know as soon as possible whether baby has any problems that need special care. The Apgar scale, standard measurement of a newborn's condition. It assesses appearance, pulse, grimace, activity, and respiration. And now my youngest one, he was born with a hole in the lung. We found out later in the other one too. They didn't tell us that at the time. And in the sac around his heart. Now, I believe the woman who delivered him did this to him when she was suctioning him out because she was being rough. And I heard a popping noise. And I said, "What was that pop?" And everybody was looking around. I said, "I heard a popping noise." Everybody's like, "I didn't hear that. I didn't hear a popping noise. I heard it." And she looked at me. And then she let them take me out to have my tubes tied. Then the doctor came in when I was in recovery and told me this about my baby. And I was so upset with them because I told them, I said, I knew something happened. I heard a noise and everybody acted like I don't know. I said, but I heard it. So yeah, she did it. Nothing happened to her, which, unfortunately that also happens. Doctors covered each other's butts and nurses. Each sign is related in terms of absence or presence from 0 to 2. Higher overall score is 10. And like my baby, he was in, the NICU unit for 5 days. He had to stay in the hospital. I got to go home. My insurance wouldn't let me stay in the hospital with him. So I had to go up and visit my baby, and that was just an awful feeling. But he was in an oxygen tent at first. And then, they had to keep scoring him on the Apgar score and everything. And till they felt like he was healthy enough, everything was healed up, and he was healthy enough to go home. So, assessing neurological status, the Brazelton scale. The Brazelton Neonatal Behavioral Assessment Scale, they call it MBAS, is used to assess neonates' responsiveness to their physical and social environment, to identify problems in neurological functioning, and to predict future development. And that's, to decide if the child might be behind in development, neonatal screening for medical conditions. Children who inherit the enzyme disorder phenylketonuria or PKU will become mentally retarded unless they are fed a special diet beginning the first 3 to 6 weeks of life. So, that's an important screening. And like I said, only your pediatricians do these screenings. So, again, you need to take your child to the pediatrician to make sure that they turn out the best that they can be. And if you miss out on that, then your child can have some serious problems. Birth trauma, injury sustained at the time of birth. And I know we've all seen those things where the doctor keeps pulling on the baby's head, the head becomes elongated, they have brain damage, and then that's because they're not, they think they can get this done, and, that's malpractice, honestly. So this can happen, Postmature, referring to a fetus not yet born as of 2 weeks after the due date or 42 weeks after the mother's last menstrual period. All my children were postmature. My oldest one was so much because they wanted to argue with me when I got pregnant, that he came out, he had a head full of hair. He was looking around and everything, and the nurse said, "Oh yeah, this guy's so postmature. He's like a 1-month-old baby." And he's got some problems. So, it's a dang shame that doctors treat their patients like adversaries sometimes, and that's not how it's supposed to be. Low birth weight, weight of less than 5 pounds at birth because of prematurity or being small for date. And there are premature babies born that they can keep in the incubator and keep them alive, and they can go on to have good lives. I had a friend whose children were all underweight, and she was a smoker, so I contributed that to that. And that's where we're going to leave that for today. So I hope that it's helped you figure out a little more about why you do what you do. Until next time.